Okay, everybody. Thank you again for joining us today. We are into our June Lunch and Learns. I think so. Last week we had our Magnolia Luncheon, which was phenomenal, and had an excellent speaker, Colonel Nicole Malachowski, who spoke to all of our women donors and those who are Women United, and a lot of the women had their daughters with them too, which was extra awesome. I felt like that was a fantastic Magnolia Luncheon, since we had to do it virtually. It was totally different. It was really cool. If you didn't get to go this year, I do recommend that you try to attend next year's. You never know. Maybe we'll be out of our United Way quarantine by then. There's no telling, but we'll see. But it was absolutely amazing how it was pulled off this year. So from that, I did want to ask everybody if they noticed if anybody was able to answer the trivia question from the Magnolia Luncheon, which is for anybody to know. So I would like for everybody to comment in the chat section if you know which anniversary we're celebrating at United Way of Broward County. Go ahead and just type it in. Ooh, all right, we got some fast typers out there. Wonderful. Yes, great. We have lots of people on the ball. So this is our 80th anniversary. So these are, we want to end out this year very strongly. I think these lunch and learns are fantastic for us to end this year and to have all of this great knowledge and to know what we're going to be dealing with next year, into next year as well. I'm so excited that we're doing these lunch and learns on the Wednesdays and learning about topics that might be new to many of us. And this one in particular is especially receiving attention these days because of the quarantine. And just to let you know, United Way of Broward County already has been focusing on our aging and isolated population before the quarantine even occurred. Of course, now it's an even bigger issue. But I just want to say a big thank you to everyone who has contributed this year, whether it be through your annual gift or giving to the COVID-19 campaign, because you have already been supporting United Way of Broward County in serving this population that we're about to discuss today. So I do, again, would like to make an ask of you. If you are considering making your annual gift, I urge you to do so that you can help us end our 80th anniversary strongly. So we start our new fiscal year on July 1st, so we will be ending this month for our 80th anniversary. And don't forget to ask me about joining our affinity groups. We have Next Gen United, Women United, and our Tocqueville Society as well. So you should have my email address from our correspondence prior to this. If not, I will type it into the chat section in just a minute. But I would like to introduce our speaker for today, Dr. Stephen Ferrante, who will be speaking on the Silver Tsunami. I love that title. He has dedicated his 36-year professional career to working in human services with various populations across the lifespan in clinical, supervisory, and administrative capacities. Stephen Ferrante was employed by Broward County's Human Services Department for 22 years, serving as the Elderly and Veteran Services Division Director for 10 years. His work includes advocacy and policy practice, grant acquisition and program development, systems of care design and capacity building, operations and implementation, training and evaluation. He has managed several projects, including national demonstrations and evidence-based programs, and has presented locally, statewide, nationally, and internationally as a lecturer and speaker. Stephen Ferrante assisted Florida Atlantic University with launching an aging academy while teaching in their Masters of Social Work program. He currently teaches for Barry University's MSW program, which was Masters of Social Work, and is a principal partner of the Group Victory Strategy and Organization Development Consulting firm. Dr. Stephen Ferrante, who serves on professional association councils and nonprofit boards, has received several outstanding service awards. He holds a doctoral and master's degree in social work. And without further ado, thank you so much for being with us today, Dr. Stephen Ferrante, and presenting on the Silver Tsunami. I'll pass it on to you.
Thank you, and good afternoon to everyone, and thank you for dedicating some time to increase information about the older adult population in Broward, including not just your interests, but hopefully also your concern for the well-being of this population. The information you're going to hear today comes out of an extensive, comprehensive community assessment that was done in Broward County to better understand the older adult population, and not just from a demographic standpoint, but also from a human service and needs standpoint as well. The work and information that's going to be presented today occurred because it was collectively commissioned by United Way, by the Community Foundation, and the Jewish Federation of Broward. That in itself was a very unique arrangement and speaks highly of the organizations wanting to leverage together to have a collective impact for older adults. And this work is also driving each of their individual and together contributions to improving life for elders in Broward County. So just to understand the scope of how this information was gathered, there was secondary data analysis that was done. There was stakeholder interviewing, focus groups, community forums, surveying that took place. There was intentional, targeted, and facilitated meetings with the system of care and representatives who are among the older adult population and serve the older adult population. And midway through the process, there was a preliminary briefing to get people's response to what was learned so far, and then to move on and comprehensively complete the analysis on what folks thought was important to wrap up the project. And you can see here that approximately 500 individuals in one way or another participated in contributing to the data and information that was gained in this analysis. And you can see the different stakeholder groups they represent. You can also see that it's not just elders, they're caregivers and people that are involved in the elder care system, but also people in the community that have an interest and an indirect relationship to older adults and their caregivers. So just so that you can get an idea, so what was the prevalence of each of these stakeholder groups that contributed? It's important for you to know that elders were at the highest percentage of individuals contributing to the information that's going to be shared with you today, followed by their service providers. You can see that their caregivers were 9% of the respondents. You can also see the range of age of individuals that participated in some way to contribute to the information gained through this assessment. And you can see that we're looking from individuals in their 20s all the way to individuals in their 90s. You can also see that the majority of the individuals were somewhere between the age of 50 and 79. And you can also see that at least or a little more or close to half of them were that 60 to 79 group. And when we actually look at 11% of them being in the older of the elder population, that was actually very closely aligned with what that percentage is in Broward's population. Now, this work and respondents in this work was certainly many more female respondents than males. That is not unusual, and one of the things we have to take into consideration here is the workforce among the service providers that are assisting the older adult population is highly female dominated, as is human services in general. When you look at the racial and ethnic division of respondents in this work, you can also see that this is very closely aligned to what that division looks like in our community as well. So one of the things that I think is important to note in sharing this information with you today is that a lot of the respondents look like if we were to examine the general public in our community in terms of having a good representation aligned with prevalence. So the first item about the demographics, I'm sure, is not going to be a surprise to most people that are listening in today, and that is that as a community, we already have a high prevalence of older adults. And we're talking here, we've defined older adults for this work as individuals 60 plus. And it is a population that we don't only have a high prevalence of, but that is increasing in numbers as well. And you can actually see the top 5 municipalities with the largest 65 plus as well as largest 80 plus population. And I'm going to share some information about poverty in that population. So remember these municipalities as we go forward in this information. The other thing that is really critical for us to understand is that we're going to have a significant amount of growth in the next 20 years. And in the next 5 to 10 years alone, we're going to have almost 250,000 residents go from being age 55 to 64 in Broward to age 60 to 74. Now, this is the baby boomer generation, and they are going to represent a considerable increase in those among our older adult population. Why is this important? Because this generation has different attitudes towards aging. They have different attitudes and expectations about how they should be supported and how their life should be meaningful and what quality of life means for them as they grow older. And that looks a little different than the generation before them. So we also have to be ready to respond to that. They are a generation that's going to want to take a far more active role in directing their elder care and their quality of life. All right, so you can see demographically that close to 13% of the older adult population in Broward are at the poverty guideline level. And actually, elders that are struggling financially or are at risk from a financial standpoint, that percentage grows when you incorporate the ALIS population, which is a population that the United Way is considerably concerned about. And that number grows extensively. And if you look at the third bullet point here about housing costs for folks, you can see that at least 1/3 of older adults are spending more on housing than what is seen to be ideal, which is 30%. So the cost of living for this population is in itself potentially an at-risk and creates vulnerability. And that is also associated with the lack of subsidized housing that exists in our community. And if we're looking at poverty in the older adult population, you can see here the municipalities where we have the greatest concentration of elder poverty. And the thing I want to point out to you is in terms of municipalities, when we're talking about high prevalence of 65 plus population, high prevalence of 80 plus population, and high prevalence of elder poverty, Pompano Beach shows up on every single list. So if we were to try to target supportive services in a group of elders that may be at risk, that is a municipality potentially of priority. The other thing that's important for us to note, unfortunately, is the number of elders that are within our homeless population. And that number has steadily increased over the years, and it has grown to 4 times what it was. And so a couple of things are contributing to that. One is just like any other population, i.e. the general population, the homeless population is also aging, and also the financial difficulties that elders are experiencing later in life and being able to afford the cost of living in our county is also contributing to them becoming part of the homeless population. So just to give you a sense of what are the most prevalent health conditions that the older adult population faces, if you know health or work in health, I'm sure that these 5 are no surprise to you, but I want to point out a couple of things about them. One is that there is a link between many of these conditions. In other words, it is not uncommon for the older adult population to have co-occurring conditions in this list. The other thing to point out to you is that this list is not only representative of physical health conditions in the senior population, but also includes a mental health condition, and that is chronic depression. Secondary to chronic depression is a high prevalence of anxiety in the older adult population. And the other thing that is not on this list in terms of high prevalence is substance misuse. And I'm pointing it out in particular because although it's not on this list, it is something that is under-recognized and underdiagnosed. But what research overall is telling us is that there is an anticipated increase in behavioral health conditions in the older adult population, including and particularly substance misuse. At this time, with alcohol misuse being at the highest, followed very closely with prescription drug misuse, most of which is unintentional, and then an increase in illicit drugs among the population. And if we think about the baby boomer population becoming part of our older adult community, we also have to think about their attitudes and practices with substances, which may be quite different than the generation before them. So we looked at, what do elders look like in terms of demographics? What do they look like in terms of their primary health conditions? Well, what about the system of care that exists in Broward County to support them? You can see that in a mix of federal, state, county, and private donation money going into elder care in this community, there's approximately $24 million invested in elder care. In looking at the system of care and looking at the allocations of funds, an important thing for us to understand is there really is no evidence that there is duplication of allocated money, meaning that money is supporting these services with duplication. In fact, as we move on in this presentation, you'll see that the investment is actually not at a level with the existing demand. But what's important for you to know about the system of care is the combination of services that exist. Some are community and home-based, some are residential-based, and some are institutional. Elders can get services on an in-home basis, an outpatient basis, and an inpatient basis. Services in the system of care are delivered by nonprofit organizations, for-profit organizations, governmental entities and municipality departments are delivering these services to elders, just as faith-based initiatives are as well. And then you have the healthcare or medical community that is driving elder care services and part of this system of care. Now, some of this system of care also is funded through programs like Medicaid for low-income elders, as well as non-Medicaid services. And each of those systems, Medicaid and non-Medicaid, have also eligibility requirements for people to receive the supports that they need. If you look at this list, the preference among elders is in-home and community-based. So to give you a little idea of what that system of care looks like in terms of the core services in our community, there is a centralized elder helpline. This is in addition to 211. People can call 211, but they can also call the elder helpline, which is operated by the county's Area Agency on Aging. That is a 24-hour line, and they can get information about services, as well as it is the link to intake for services for elders. There's also a system of centralized case management for the older adult population that the county operates. That is, however, only for publicly funded services, not for all funded services. Services for elders in terms of in-home include personal care, homemaking, and respite care, as well as nutrition. And a number of these services are available for elders that receive them in facility care or institutional care as well. For elders in terms of recreation and socialization, there are senior centers throughout the county, as well as recreational centers and departments and activities for older adults. And our community also includes evidence-based initiatives that are focused on health promotion, keeping seniors healthy. And those are targeting not only their physical health, but also their emotional health. Because many elders struggle to maintain housing, even housing that they own, some elders are faced with substandard housing, and so there are home repair programs for elders, energy assistance programs for elders, as well as services to guide them to better understand their health insurance and legal issues, as well as negotiate those. In our community, we also have some specialized behavioral health services, mental health and substance misuse services that are designed specifically for this population. And we do have housing to prevent elders from becoming homeless, as well as housing that is subsidized for those who are low income. And the last thing that's important to note about our services, although these are not services that are funded at a high level, we do have some pilot projects for elders who can direct their own care, and there's resources available for them, as well as folks that are on a waiting list to get off that waiting list and receive supports that they play an active role in coordinating. So what do we know about our system of care? How do elders in need and their caregivers access what's available? Well, the way that the formal publicly funded system is currently set up, and this includes Medicaid services as well, is that you have to be functionally impaired to receive services. You have to be financially eligible. You are assessed using a comprehensive assessment, and those at the highest risk are those that get into services. This is a crisis-driven system. What's missing in this system is that if people are at risk but not in crisis, and they would benefit from some services to prevent them from going into crisis, there's little to do to help them in the formal system of care. And part of that is related to the extensive wait list that exists in our community for elders in need. There's also some things about the system that are challenges as well as strengths. One is that in this work, we consistently heard from elders and their caregivers and other key stakeholders in the community that there's not enough education in the community for folks about what's available and how to access it. And when people do learn and they attempt to access it, the negotiation that's required to get services is not user-friendly and can be quite overbearing. There are, however, quality programs and services. In fact, the majority of elder care services in this community are offered at a very high level of professionalism and quality. And part of that is related to the competence and dedication of the staff in these programs and agencies. In fact, this network has very low attrition, and so there is considerable institutional knowledge and longevity, which contributes to continuity of care for this population. Also, there's incredible motivation among providers who traditionally have operated quite independent of one another to actually start collaborating. And this assessment and the work that United Way and Community Foundation and Jewish Federation have done has only helped to contribute to increase in that collaboration. So from the stakeholders' perspective, what did we learn? Well, there were 4 themes that arised from this work. One is that the basic safety net of services or system of care that exists has some significant gaps, including gaps related for demand of service and type of service. that this then unfortunately translates into isolation for elders, particularly elders at risk. And because there's a considerable amount of elders with limited finances, this also has a direct effect on their quality of life, as well as social determinants related to their health and well-being. And then lastly, there's opportunities in our community for us to improve the perception we have about the older adult population and how our perception perhaps filters in to the type of supports that they receive. So starting with the holes in the safety net, what are some of the issues related? And these are mostly issues at the systemic level that are important to understand and perhaps as a community try to address and improve. Talked about the level of awareness around what's available, as well as the difficulties in accessing what's available for elders. And part of those difficulties don't only exist in the formal elder care system and publicly funded system, but those navigation difficulties also exist in healthcare settings for the older adult population. And in fact, there are opportunities for improved communication between the healthcare system and the elder care social service system, because things unfortunately still are fragmented for individuals that access care. So if I get into care with one provider, it is not always likely that they're going to be connected to other providers that could collectively do a much better job in addressing my needs as an older adult and even as a caregiver for elders. So these disconnections between the medical and community-based community, as well as the nonprofit and for-profit community, translate into struggles for the older adult population and their caregiver. And that is unfortunately also related to not a lot of trust among those populations in the system being there for them, in the system being responsive to them, and the system being able to provide assistance for them. And as you saw with the information about the wait list in this work, that the demand for service far exceeds the current funding level of services. Another thing that challenges the older adult population, and it probably challenges the lifespan in our community, is the transportation system in Broward County and the challenges associated with transportation for people who have disabilities and require paratransit support. Moving on to the second item in the four major themes, the effects of isolation, and this is directly related to wellness in the older adult population. So social isolation, and in the last several months, you could be any age to have experienced social isolation. So maybe we've been in the shoes of many older adults, what they've been experiencing on an ongoing basis in our own experience with the isolation we had to deal with the pandemic. But obviously that has effects on people who are at risk, remaining at risk because of their isolation and loneliness. It also has significant effects on people's emotional health. And in our community, we have a subpopulation of elders who could be termed orphans. And what do we mean by this? Well, that subpopulation is comprised of older adults who are here, but their family is somewhere else, in another state, in another part of the country, and there's not a lot of support coming from their family. So in many ways, they are here to try to fend for their quality of life on their own. In Broward County, we also have a considerably large population that is LGBT+. This population is aging like other populations. They also have some challenges associated with family support, with finance, and with health disparities. What people in our older adult population are looking for, and perhaps many of us in this Lunch and Learn today care about as well for ourselves, is the ability to age in place the way we define our quality of life and to be supported so that that successfully happens for us. And staying in our own home is typically what people are most concerned about. And if my home is a place that becomes substandard for my well-being, and there are limited resources to help with repairs or even modifications so I can age in place, that presents vulnerability and risk for me. We also know that most elders are getting into services because somebody finds them at risk and calls on them. There isn't a lot of outreach going on in our community among human service providers or even gatekeepers in the community to actually identify risk before it becomes a major crisis for the senior and their caregiver. Also, we're not doing a lot in terms of prevention and early intervention work because we currently have a crisis-driven system. So these are also opportunities for our community to intervene early on and keep people well, then wait until their situation is at a place of extreme difficulty for them and health risk before we actually step in and give people the assistance that they need. And that type of crisis-driven system is also much more costly than a prevention and health promotion early intervention system. There's incredible burden on caregivers for elders. Those could be their spouse, those could be their children, and they could also even be their grandchildren. And the other thing for us to understand about isolation and wellness in the senior population is their desire for purposeful activity. And for some, that could even mean employment. In fact, there's a considerable subpopulation of elders that have to continue to work in order to be able to afford their livelihood, as well as those that are looking for significant civic engagement. When we talk about their economic issues and affordability in this community, we know, unfortunately, that Broward has issues with affordable housing. And what we need to think about in the senior population is coupling that with specialized housing, meaning that there's supportive services in the housing communities in which I live so that I can stay in the housing of my choice. As the cost of living continues to increase in Broward County, elders that are on fixed incomes are finding it extremely difficult to be able to maintain expenses on a monthly basis. And if we have elders with longevity, we also have the challenge of those that are outliving the assets that they have set aside for their later years. In addition, there are considerable costs with healthcare and medicine that are out of pocket and create financial challenges for the older adult population. And again, elders and their caregivers talked about the economic issues with maintaining their home and keeping it as a safe place for them to live. The last point to share with you about the themes that arise is, what does the community think about the older adult population? What is our perception of them? And what we unfortunately learned in this comprehensive community assessment is there wasn't a high appreciation for elders. In fact, many people define them by disability, by limitation, and burden. Many people also prescribe to chronological age, also has to do with people deteriorating. So there were issues of ageism, and even in healthcare providers, when elders complained of certain issues, just automatically writing them off as these are things that happen in older life, and there's not much that can be done. The other thing to remember about community perception is possibly in Broward County, we're not realizing all of the intergenerational engagement opportunities that could potentially benefit people across the lifespan. And elders and stakeholders talked about that as well. So to wrap this presentation up for you, what can be done. And let me preface that by saying that the United Way Community and Jewish Federation are already moving forward and have been for the last couple of years on working collectively to do something to improve elder care supports for older adults in Broward County. But some of these issues are at the system level. And that is that there isn't a collective advocacy effort among providers to advance elder adult issues and funding and policy that goes into elder care, not only in our community, in our state, and that type of advocacy campaign would be beneficial. There also doesn't exist a specialized fund for elder care services. This would be something similar to the Children's Services Council, where there's a dedicated fund for money to go into elder care services. Right now, there are a variety of funding sources, and they're not leveraged together. Although the work that United Way Community Foundation and Jewish Federation are doing is in this effort. There's obviously a strong immediate requirement that there be resources that go into the safety net, critical care services that are currently underfunded, as well as resources that go into better community campaigning and education around what's available. And also marketing that helps us have a more realistic and positive picture of elders and the contribution they are and value that they bring to our society. And certainly community action also needs to be focused on how are we identifying people early on in risk and not at point of crisis, and helping them to more effectively access and navigate and coordinate their care in a way that works to their health promotion, and doing something to remove people waiting for services, because as people wait for services, they deteriorate. And then their level of need is much higher when it's time to provide services and much costly than it would be. So some other things that could be done is to get behind reinforcing the interagency collaboration that's beginning. How do we support providers in doing that, in regularly networking? How do we also form better partnerships with first responders and people that may see or reach elders when they're at points of risk, and make connections so that they can get elders in care? And some of those gatekeepers are people like postal carriers, people who work in hair salons, people who work in banks that may see older adults consistently over time and be able to recognize them. Other things at the system level is how can we do a better job of coordinating the case management that's going on, and improving the system's ability to respond to elders and elders' ability to navigate. And ideally, can we get the network on a single client management database so that there's a way for them to know elders from a service standpoint, what services they're receiving, who's else is working with them, and how they can collectively better serve the population. And then because we have an aging network where we have a high longevity of individuals working in elder care, we also have a lot of folks reaching retirement age in the leadership of elder care in Broward County. And how do we better develop that workforce so that we could have strong leadership indefinitely and not have it leave as individuals retire out? AARP has an age-friendly communities initiative. This may be something that's important for some of our municipalities to look at, particularly those municipalities with a high prevalence of 65 plus, 80 plus, and elders in poverty. We have larger issues in our community about affordable housing and transportation. How does the elder care network better interface and help to improve those larger systems? And then how do we keep people who have an interest, including donors and giving to human services, to think about elder care and to think about investing in the older adult population. And part of that has to do with what do we do as community or a network in terms of improving a positive outlook on older adults and doing a better job of establishing health promotion services and approach in our care. And the last thing for us to remember is that when we support the caregiver, we're supporting the caregiver and the elder. If we leave the caregiver out, we are potentially still leaving a risk in the elder's life, even if we're trying to provide services to the elder themselves. So at this point, I'll open it up to questions, answers, and any feedback.
All
right.
Okay.
Stephen, so we have one question here, and it asks, where do seniors go to access these resources?
Sure. So as I mentioned in the presentation, there is a single elder helpline that is operated 24 hours by the Area Agency on Aging of Broward County. And so that is a number that elders, their caregivers, or others can call, and they can find out what services are available and what they are eligible for. And let me, while I answer some other questions, look up that number so I can give it to everyone. All right, the elder care number is 954-745-9779. Again, the elder care hotline in Broward is 954-745-9779.
All right, so that is all that we have in the chat box, and I encourage anybody who has another question to go ahead and ask it now. Stephen, I actually have a question for you, if you'd be so kind to answer it. With COVID, and you touched on something earlier that I think a lot of us might not have really thought about, and that is we all now have some degree of understanding of what isolation looks like. And while it might have been for a short period, some of these people, these older folks in our community might have been experiencing it for some time now. Have you seen or heard of anything creative that people are doing in order to engage the elderly in their own communities, or find ways to strike a conversation with them, or just to, let them talk for a while? Is there anything that you've heard of or you're aware of?
Sure. So let me first say, just to reinforce the point you're making. So all of us, or many of us, have experienced social isolation because of the pandemic. During the time we were experiencing it, it's possible that we were quite healthy and we were well. And maybe we had, some challenges associated with not being able to socialize at a level. And, that may have some, emotional effects on us. Now, look at somebody whose physical health is deteriorating, whose mobility is deteriorating, and they're also socially isolated. So they have all of these health risks, and they're in this situation. And we know that situation from someone who simply was healthy and it challenged us. So I just want to reinforce the experience from the elder perspective. Now, in terms of, so what's innovative or what's going on? So it just so happens that the three organizations, United Way Community Foundation and Jewish Federation, chose social isolation out of the four top themes as their first area to make a considerable investment and start granting in programming that would address senior isolation. Now, I don't know all of the specific programs that they have funded. There may be some folks on the webinar that can share that, but they have funded some innovative initiatives to address social isolation in the senior population. And one of the things that I also know is that some of their providers became very creative in remaining connected to seniors even when they couldn't see them face to face during the pandemic. But there are, not only in our country, but in other countries, innovative ways to address social isolation in seniors.
Excellent, thank you. Do we have any other questions from the attendees?
Yes, hey, it's Kathleen. I put a question in the chat. Stephen, you had mentioned the elder care tax, very similar to the Children's Services Council, which I think lots of folks on the phone know that there's a kind of a taxing district in a sense, and it takes care of children's services, which is so important. But we also know that there's such a need for comprehensive services for our senior community. And as you eloquently pointed out, that is going to expand, which is phenomenal, and people are living longer. We tried several years ago. We also put in some feelers last year and flavored it out. And every year seems to be unfortunately, some type of a crisis. We had Hurricane Irma, then we had Marjorie Stoneman Douglas. Obviously this year we've got COVID. Something always kind of pushes it to the side where people don't even want to gather and really try to see if they can get it passed. Do you have any sense of the flavor for that, or how many others in our community have that? I don't think anyone in the state of Florida has it, but just curious.
No, so there aren't any areas in the state of Florida that has that specialized fund through a taxing district. But one thing I would point out in what you just shared with us is when there's a hurricane, it has a significant effect on the elder care population. When there's a pandemic, it has a significant effect on the elder care population. This is all connected. These are not individual issues. They're all related. If there was a specialized fund like there is for children, you'd have the ability, when there's a hurricane, when there's a pandemic or any other crisis, to have resources available. So it also in some ways may be a proactive approach. I know there isn't the political appetite for something like this, but it isn't something, to just abandon, including, are there other ways than, through a legislative process to get something like this established. I would venture to say that the work that you're doing with the Community Foundation and the Jewish Federation, you have informally established a specialized fund for elders. Now, it's not a huge fund like the Children's Services Council, but you have done that. You have taken the first step to do something like that. So, what can be done maybe for others to start contributing to what you're doing so you can do this informally until it's something that can be created through a legislative process.
Actually, Stephen, that's a great, we could showcase the partnership to our legislators, compare it to the Children's Services Council. Obviously, dollar-wise, there's no comparison, but show the outcomes of Children's Services Council. And I agree with you, and you're probably talking to the choir here, that hurricanes, the COVID, everything that's going on, this would be such a proactive fund that would already take care of that community if we had that. So we're committed to continuing each year to try. Nan Rich would be a champion, and we would need to certainly get a champion on the other side of the aisle, but she's a local champion. We need a state national champion. But let's, together, for folks that are on this call, let's not let that go. I think that is extremely important. And out of the tax dollar, your taxes will be so minimal that you as a taxpayer really won't feel that. Obviously there is going to be some dollar amounts that come out, but it's not painful to the taxpayer, and think of what we could do for our senior community. So want to keep folks focused on the programmatic issues that we're managing and dealing with, the social isolation, but not to forget the public policy side and the shift of legislation that we could actually do to fortify this fund right now that could really last forever. So thanks for showcasing that, Stephen. And thanks for being our champion here with all these, with our three amazing partners. And we actually have some new funding partners that are in too, which is really nice. So.
Excellent. I'm happy to hear that. But the other thing too, think about elders comprising about a quarter of Broward's population. Children comprising about a quarter of Broward's population.
It's a lot of people.
So, I mean, on both ends of the age spectrum, we have populations with vulnerabilities and support needs.
Yes, we do.
All right, so thank you. One more question, maybe if you could be brief about the robotic pets for seniors, I see here. Do you know anything about robotic pets for seniors?
Yeah, that's interesting that that's asked. So the Florida Department of Elder Affairs has recently launched an initiative with through their Livable Communities Department, where their elders can access robotic pets. So if somebody's interested in learning more about that initiative, I'd go to the website of the Florida Department of Elder Affairs, go to their Livable Communities unit, and you'll find some information about that initiative.
Awesome. Well, I think that does it for me, Stephen. There were a few requests for the slide deck, so I'm sure Catherine will send that out if it's available to her. Thank you.
Yeah,
Stephen, I just want to say I really enjoyed the presentation, very comprehensive as always. You mentioned earlier in the presentation about the baby boomer population being kind of on the rise in terms of the senior population and them wanting to have their say and kind of how they are cared for. Can you talk a little bit about kind of where we are with the engagement of our seniors, seeing them as an asset in our community and using what they have to give us in order to move forward?
Yeah, we're not very far there. I wish I had something positive to share, but it's something that we really have to give a lot of consideration for. Traditional aging services are not what the baby boomer generation is interested in. They're going to define their quality of life by you know, a different type of meaningful activity. And I think we're going to need to better seek to understand that population. That's going to be really important because of, you know, almost 250,000 in the next 5 years entering the older adult population. And I think the best way is to, you know, start engaging them and working with them because they're ready to define what their quality of life looks like. The other thing that I mentioned that is strongly related to this population is that what are we doing in health promotion? How are we keeping healthy seniors healthy? And that's incredibly important for the baby boomer generation. And it will save us money if we start to think about how do we shift our system from a crisis-driven system to more of a health promotion system. That's going to be incredibly important for this. It's important for all ages, but it's important for this population. And I think the last thing I'll say is that unfortunately, a disability or a health crisis is a disability or health crisis no matter how old you are. So we can't forget that either.
Thank you.
Thank you, everybody. Thanks for your questions. Those were fantastic. If you didn't have something answered and you think of your question later, definitely send me an email. I would be happy to get that information to you. I'm typing my email address down in the bottom. Again, a big thank you to everybody for being here today. Thank you, Dr. Stephen Ferrante, for informing us of all of this new lingo even. I heard the word elder orphans, and that just made me so sad, but it also just made me think about all of these individuals that we have that we do need to get creative about reaching out to just as an individual too. I'm thinking about calling somebody that I know right after this. I also heard about the robotic pets. That is really interesting. We also have pets that have been going out to visit the elderly. So those are still occurring during this time. So we have been working in different areas. Oh, Mission United, we had identified several isolated every other week. We still might have some spots available to volunteer to do that if you're interested. and those are just a couple of the things that we have been working on that your dollars are going to help us serve the community. So again, if you are interested in being a part of the solution that we are helping to create out there, I do urge you to make your gift for our end of the fiscal year to help us make all of these things occur, to help make Broward better every day, because you have the power to do that. And we appreciate all of you who have given, those of you who have made your annual gifts, those of you on Next Gen United, Women United, Tocqueville Society. If you want to know what those are, if you don't already, my email address is in the chat box. Feel free to reach out to me. And thank you again, Dr. Stephen Ferrante, for being with us. We appreciate your time. And
Thank you too.
we all got a lot to take back with us. So we'll conclude this, and hope to see you next week on the next Lunch and Learn. Thank you, everybody.